Welcome, welcome, welcome to Medical Message Moments. This is your host, Tracy Brown Dorsey, with my co-host. I have a guest co-host again today, Miss Kiera. Will you say hello?
Hello, everyone. Peace and blessings.
And Troy will be in just a little bit, but we want to finish our series on diabetes. And it's not actually a finish because we have so much to cover. So this week is going to be kind of interesting. We're going to have some fun facts. We're going to have some tips to how to prevent. And we're also going to have some great information on what to do if you are a diabetic or a pre-diabetic. You ready, Kiera?
I am ready.
All right. So last week we kind of talked about diabetes in general. And we also had several people who called in with some phenomenal questions. So this week we're going to continue on. Kiera talked a lot about eating, and I know that's what a lot of people have issues with. So we're going to talk about that portion. Remember our theme, do you live to eat or eat to live? We can use food actually as a source of treatment for diabetes. So I guess I'm going to start off first, and then Kiera, you can let me know where you want to head with this.
Okay.
So first, I want to talk about some supplements that you all should have in your homes to help you combat diabetes. Now, everything that we're mentioning today is going to be in our diabetic power pack, but you also can do some research and find these things on your own. Now, the first one I want to mention supplement if you are a pre-diabetic or you are a diabetic is chromium. Kiera, have you ever heard of it?
I have not. Please enlighten me.
Awesome. Chromium is a wonderful supplement, and it's very good about strengthening the pancreas. It also helps us with processes of the liver. So I suggest about 200 milligrams a day, 3 times a day. So I would like you to take it when you eat. Now, you have to understand, when you eat, the objective of this is to turn that food to fuel to keep you moving. So with a diabetic, sometimes the conversion of the fuel doesn't happen. It either happens too much glucose, too little, or it just doesn't break it down the way it should. Chromium will definitely help you. This is an inexpensive way to do some magnificent things. The next one is going to be good old-fashioned cinnamon. Now, cinnamon's been around a long time. Now, some people use cinnamon in their oatmeal. Some people use cinnamon on their toast. Some people actually know how to make a drink that involves cinnamon, which we will talk about a little bit later. Cinnamon suggested is 1 teaspoon in the morning and then 1 teaspoon at lunchtime. That both of these will really help the pancreas to do the job that it was designed to do. So if you just think about it a little bit, we work better when we're motivated. You guys know, you go to work every day. We go to and expect twice a month to get a check, right, Kiera?
Absolutely.
All right. So with this, this is actually telling the pancreas, hey, I expect you to turn food to energy, so I'm going to give you a reward. The next supplement I want you to have in your arsenal is fish oil. Fish oil reduces internal inflammation. So we are using fish oil in so many ways. We want to be sure that we add that to your daily because it's going to help you in the cholesterol area. It's going to help you with the diabetes. It's going to help you with several maintenance issues. So something as simple as fish oil can be your power supplement. And the last one I want to talk about is ALA, which actually helps with the pancreas. And I said the last one. I got another one I want to sneak in there. But it helps with the pancreas. Again, the pancreas is the main organ for diabetes that we want to strengthen up so he can utilize and turn that food to energy and produce enough or just the right amount of glucose. Now, one that you may not know a lot about or know that it does help with diabetes is magnesium. Now, a little bit later, we're going to talk about foods that have these things in it. When we just talked about supplements, but we're going to talk about foods that have these items in it. And again, I'm giving you back your power. So, Kiera, you want to add anything in before I go on?
You did an excellent job. But, yeah, just From what I've learned as far as working with diabetic patients is that, keeping them focused on a diet that actually is high in carbohydrates and high in fiber. These actually help to reduce the need for insulin. So, it kind of helps the body to continue to regulate. Also understanding that low fiber will bring on diabetes. So always adding, more veggies are always welcomed. Also, onions, believe it or not, onions have huge healing benefits. One of them is lowering the blood sugar. So I love to just add them pretty much into everything, especially living out here in Texas. Just season them up. You can fry them up. You can saute them however you want to do them raw. On tacos, they're awesome. Also, keeping in mind, staying away from fruits that are, more higher in sugars, things like bananas and apples. Not so much of a great choice for diabetics. However, blueberries are a great choice. Also, watching out for your caffeines. Coffee is one that will actually induce a very high blood sugar. So kind of, being careful with that. Even if you are having just, the black coffee, be considerate of the amounts that you are consuming in the mornings.
Very good. Well, I want to give you a couple of quick facts, and then I want to talk to you about those two fruit that you just mentioned.
Okay.
Now, a couple of facts. The name of this series is Know Your Number, so I'm going to give you another portion of the series called Let's Transform. Now, we need to transform because if you have this condition, you have a history of this condition, you already are preceptive to have these different maintenance problems. So we have to transform this negative to a positive. Now, I'm going to give you some facts to scare you so you know we're serious about this. But 1 out of every 4 people have diabetes. Did you know that?
Wow, I did. That is very sad, but I did.
25% of everyone?
25% of everyone.
Wow.
In the United States. 700% increase over the last 3 years, diabetes.
Wow, the last 3 years.
Last 3 years. So this is serious numbers. This is something that we really have got to take control of. Now, I will tell you this, just another little helpful hint. In the past, how we took care of diabetes was by medication. Everybody agree? Troy's joined us. Everybody agree?
Yes.
All right. Well, let's just talk about one fact. Let's focus more on being better what we put into this temple. But New England Medical Journal in 2010 had a drug called Avandia, very popular diabetic drug. Well, they decided that after several clinical tests that 43% of the people who were asymptomatic but on diabetes medicine that took Avandia wound up having a heart attack.
Wow.
63% of people who started on Avandia that didn't have a cardiac problem before had cardiac disease.
Wow.
63%. So in 2011, there was a big decision on whether they were going to keep Avandia on the market. But by that time, 84,000 people were on Avandia. So now, if that doesn't give you the power to try to figure out how we can put better things in the temple to get better response. So I hope I got everybody's spidey senses up now and really listening for the rest of the show. And call in and give us some questions if you want, but we got a lot of information to cover. Now, Kiara talked about a couple of fruit. So now, what fruits are good? So she gave a couple examples, and I'm going to drill into it just a little bit more. Now, if you want to think about it, I want you to have less than 50 grams of sugar a day. Now, for some of you guys, that sounds like an incredibly low amount. But for your body, anything over 50 is a large amount of sugar. So we have to start thinking about who holds the sugar, who holds the power. So now let's think about who doesn't hold the power right now. Lemons. Lemons are, if you were to do a whole lemon, he only has 5 grams of sugar. So that means we got a little bit to play with, right?
Right.
Now, Kiara last week mentioned berries. So we're going to talk about berries, like raspberry, for example. We're going to talk about raspberries versus bananas. Okay? Now, both of them are good, right? We agree?
Yes.
Okay, so now it's more so about what's better for me. We can use both of these in toppings of yogurts, in smoothies. So now which one of these are going to be a better choice? All right. Raspberries. 1 cup of raspberries, full cup of raspberries, only has 5 grams of sugar. Okay? 5 grams. Okay? It also has 8 grams of fiber. You mentioned fiber earlier.
Yes.
All right? Now, a banana. A banana has 15 grams of sugar, and he only has 3 grams of fiber. So sometimes what happens is people think about the fruit and think about what they can get from them. You've probably heard, you eat a banana for what? Does anybody on our panel know? What have you been told bananas will help you with?
Potassium?
Potassium.
Yeah.
Actually, it doesn't have a lot. So it would. Now, if you were to eat a dozen of them, we might have something, but we also would have some very high sugar content.
Exactly.
So it doesn't really have as much potassium as you may think. So when we're talking about the choice is something that's low in sugar, but yet high in fiber. So raspberries would be a better choice.
Raspberries, okay.
Raspberries. So this is why we're really pushing knowing your numbers and knowing your conditions. We actually have something coming up on the 20th. If you're in the Dallas, Texas area, we're having a Healthapalooza. And it's at my clinic, actually, and we have several doctors and guests that's going to be there. And if you cannot make it and you have signed up on the mailing list for either my site, which is www.preventivemedical.net, Kiara site, which is
KABAREMEDIES.com.
okay. And Troy has a listing as well, and that's going to be a special surprise that we're going to talk about next week when Kiara and Troy are by themselves. All right. So moving on. Now, you also mentioned fiber. Very, very, very proud of you for that.
Yay.
Fiber is, if you think about fiber, he is, when you go through the car wash, and you know how the cars go through the car wash, and you wonder how in the world do substances not stay on the car. This is really fascinating. I know when I go, I'm mesmerized by car washes that I go through and I can kind of look at. Well, each thing that's in there is pulling at the car and pulling something off of it, whether it's residual, whether it's dirt, whether it's soap, what have you. But each time that you're going through, it's pulling something. So your end result is this pretty shiny car, right?
Awesome.
That's what fiber does. It pulls the toxins. It pulls away, things that maybe you have eaten, different things, stool, things, your system being cleaned out. It pulls all these things out so we can have a pretty shiny body.
Awesome.
Okay. So fiber, big, big, big one. The next thing I really want you guys to focus on is what and how you're cooking things.
Ooh.
I need you to get some coconut oil.
Coconut oils.
Coconut oil is wonderful, as Troy's word, monogamous.
Unanimous. Now, does it
I
make a
couldn't say
difference? Does it make a difference if it's like organic or refined, or does it matter?
Well, for cooking, you're only going to really have one real one. So I do want you to get as close to organic as you possibly can.
Okay.
There's a place for organic and refined, depending on what you're doing with it. But I want you to start cooking with coconut oil. Some of you good Southern cookers, my aunt in Chicago, like the best cook in the world. All my cousins will probably call me in just a minute and co-sign on this. Best cook in the world. And so I don't know what she based her food cooking on, but since everybody goes there to eat, if she was to sneak and change her oil to coconut oil, I doubt very seriously if the people would stop eating there, because she is a phenomenal cook. So that type of little trick is a great thing in the response of the body. Coconut oil burns fat, and it also controls glucose levels. So it's very important that you actually do this. I use coconut oil as a butter as well. It has a little taste to it, and most of the time we use butter to actually accent something, and so it can accent for us without some of the residual. Also, you can use coconut milk. Anybody ever had coconut milk?
I love coconut milk.
Yes.
Coconut milk is very good. It's a great way to actually get that same process, which is the burning the fat, the controlling the glucose levels, the helping cleaning out the arteries. All of these things can happen with something as simple as changing over that one thing, which is the coconut. I got a chance to go and visit several islands where they eat a lot of coconut. And it's amazing how different their health response is. So that's one. Now, I'm going to take a little break here, and I want to see if I could ask a question. Let's see here. All right. I got one question here, and I think Troy has a question as well. So this person wants to know, what does an average meal look like? It's a great question. Great question. Now, average meal is going to have to be from what you do from day to day. I can tell you what my average meal is. I don't eat meat. That might not be your average meal. So, but I do want you to know each meal should have fat, protein, and fiber. Now, you know what I left off? Anybody know anything I left off? Them sugar and carbs, right?
Yeah.
Now, you need carbs, but carbs need to be a minimum. If you increase the protein, increase the fiber, and do good fat, your only response left is better health.
Dr. Dorsey, I have a quick question for you. What exactly would be like, what would be a good selection of a fat for our listeners? Like as far as them adding it into their diet, into their meals, their average meal, what would be a good fat? Like as far as a veggie or whatever your recommendation is for a healthy fat, how would we get that?
Okay, that's a very good question. There are several ways to get you some good fats in. We talked about earlier some of your oils, subbing some of your almond oils, your coconut oils. Those are good fats. Guacamole is a good fat.
Love it.
Oh, yeah.
Yeah, avocado would be a good fat. So this is something, we were talking today about power recipes, but that's something I do a lot. I'll take an avocado and put tomatoes inside of them with some coconut oil and olive oil and stick them in the oven. And then when I come out, it's a wonderful taste. Throw a little cheese on it, and we're good.
Okay, yeah.
So that's a very good fat.
Breakfast, lunch, and dinner. So.
You're right. You're right. Troy, did you have a question over there before we go on?
No, but I guess I was going to ask you about the 5 myths of the diet, like top 5 myths of diabetes, but it's going to go into a quick break.
Okay, well, we'll go to a quick break. When we come back, Troy we're going to talk about these 5 myths.
Okay, guys, stay tuned. We'll be right back with Medical Message Moments. Thank you. All right, welcome back to Medical Message Moments with Dr. Tracy Dorsey. All right, we are going over the topic of diabetes today. All right, and I want to get off into some of we looked up the top 5 myths about diabetes, and one of those myths, Dr. Dorsey, was does a diet cause type 1 diabetes? And if you, Kiara, want to chime in on that.
I think we probably both were. We were both sitting up here bouncing in the chairs. Type 1 diabetes, you may have heard, and type 2 diabetes, you may have heard. And I have a type 3. That's the one who supports a 1 or 2. But type 1 is generally when you don't produce enough insulin, and that's usually a juvenile diabetic. Generally, that's what it is. Now, most people don't think about is that type 2 is the one that may be controlled a little bit more by diet. It may be controlled a little bit more about your social surroundings. Right. But type 1 is just that organ who is not doing what he's supposed to do pretty much from the beginning. So usually that's a juvenile diabetic.
Exactly.
Juvenile diabetic, okay.
Right. You usually, for the type 2 diabetics, it's usually an onset maybe within the 40s or toward the late 40s for them. So like she said, it's, usually an earlier onset for type 1 diabetes. You're going to know usually before you're out of your teens if you are diabetic or not.
Now, lately I've had a lot of people who ignore symptoms, and I've had juvenile diabetics that were diagnosed in their 20s. So they've had the problem for a long time. They ignored some of the signs. Some people have darkness around their necks. Some people sweat a lot. Some people have palms that are sweaty. Several hints. But when we're young, we're invincible. You guys know that.
Yes.
So when you're young, you're invincible. You don't think about these different things. And until you have what's a crisis, then we are at the hospital ruling out things, and you're in there with the 400 sugar, and now we know.
Especially if you're playing sports. Or
exactly.
Like that. Yeah,
exactly.
Ignore those
I'm very happy. When I do sports physicals, I do a very intense on Of course, everybody does urinalysis, and I do glucose. I really want to know. And if we do more things like that, if we take our children and get them their annual physicals, especially our teens are more likely not to want to get a physical. And only physical they know is a sports physical. But if we can get them to get a physical, we may actually see cardiac disease that may have been undetected or evolved from youth problem of small to now teen, where it's a big problem. We're seeing more and more children who are having like illnesses that are causing them to be terminal when it's something that maybe was a maintenance for us that we could have checked to find out. So again, we want to get those children tested so we can see if they're type 1 diabetics, so we can see if they have juvenile induced cardiac problems, things like that.
And what's a good way, what's your website again, in case they want to get the children tested?
www.preventiveMedical.net.
Excellent. Okay.
Another thing, Carrie, you mentioned about the age group. Generally, people start paying a lot of attention in their 40s. However, we have a pre-diabetic area that is going kind of unknown or non-observed, especially in, men folk. Men folk don't go to the doctor unless there is something absolutely wrong a lot of times. Women will go for a hangnail. So we'll get everything checked out. So there is a blind spot in diabetes, and it's all about not knowing your numbers early. Okay.
Yes.
Sorry about that. That's one of my soapbox.
No, very good. That's very good. Very good.
So, Troy, one myth that I hear a lot is, diabetes, they don't run in my family, so I'm good, So.
Yeah.
Oh, my goodness.
Yeah.
So, Dr. Dorsey, what do you have to say about that?
Family didn't eat this diet either.
Well, since we said that it is some diet-controlled areas, some social areas, you having a family history of diabetes doesn't go either way. You can have a whole family of diabetics, and you can make a choice to live well and eat better and live better. Walk, exercise, eat right, lower your sugar intake. All these things will help power you to combat diabetes.
Yeah,
So,
and just to interject really quick, something, Kiara, I was thinking about what Dr. Tracy said earlier about the 700% of the diabetes cases have come up recently, right?
Right.
It has increased 700%. So those people, it's a good chance that their parents or grandparents were not diabetics, but they developed diabetes within their lifetime.
That's right.
So that's something to really think about.
Now, when we're talking about being proactive, my son and I started our garden. So we got cilantro, basil. So I'm doing all these things to try to help him understand too. Let's go back to vegetation. Let's go back to growing our own foods, so we don't have to worry about what they're putting in it to make sure they have the biggest watermelon in the planet.
Right.
So we want to make sure that we're going back to those basics and going back to seasoning our food using some spices that are not Miss Dash. Let's make our own. Miss Dash is full of sodium. Yes, it spiced your food, but we also could have used, as Kiara said, the onion, celery, bell pepper, and basil. We'll put it over, let's just say you eat pork chops. Put it over pork chops, put it in the oven. This is a great way to cook it. If you're going to eat that meat anyway, let's figure out how to get as much of the nutrients that we can, less the fat, and let's try to make this a power food. Anything you eat, let's put something on it that's going to make it powerful.
That's a good idea. Good idea. Okay, well, moving on to here's another myth that that was discussed, that was brought up. So people with diabetes simply cannot eat sugar. Now, do you guys agree with that or disagree?
Well, sugar is not our friend anyway, but the diabetes is not the reason why you cannot have sugar. Again, we're back to moderations. I remember teaching a diabetes class last year, and it was a group of men and women. And I was explaining to them that their portion size, if they would use the palm of their hand to try to figure out their portion size.
Yeah, I've heard that before.
So one of the ladies that was there said, "Well, I do use portion size. I use my husband's hand because his hand was much larger."
So who was her husband? Shaquille O'Neal?
Exactly. So it's about moderation. It's about alternatives. You can have things that you want. I'm not telling you not to have sugar. I'm not telling you can't have a piece of cake. I'm saying that it needs to be in moderation. And also, I don't want you to have a big chunk of cake and a Coke. Can we at least wash some of that down with some water? Can we at least help filter it a little bit? And not a Diet Coke, because truth be told, Diet Cokes, diet drinks are often worse for you than regular drinks.
Yes.
Really?
Yes.
Yep. So truth be told. Now, there's also some other variations. Now, people think that if I had this bread and then I had this little small piece of cake, and you would think, or I don't know, I'm trying to think of something else, another thing to do, another comparison. But if that was the case, and I had this piece of pie, and I had this, bowl of pasta, okay, that bowl of pasta, that grain, that white grain, would be worse for you than that little piece of pie, because that grain will metamorphose to a stronger sugar than that little piece of pie did.
Yeah,
now,
pasta. I
don't necessarily want you to have either one a lot, but if you're thinking about it, don't just get masked. And that's what a lot of myths do, is they mask that sugar is your only enemy. That's not true. And he doesn't necessarily have to be totally your enemy, but sugar is a poison.
Totally agree. So one more myth for you.
Okay.
Type 2 diabetes is mild.
Okay. Now, I'm going to go with, I tell people all the time, I think I told you last time too, when people tell me they got little diabetes and they got mild diabetes, I want to know, can you be little pregnant or mild pregnant? Is that possible? I'm just asking. So if you have diabetes, you have diabetes. If your pancreas is not working like it should and it's impaired and you are pre-diabetic, you're still on that diabetic spectrum. So it's time for us to take control and do something about it. Okay? So no mild diabetes.
Okay, speaking of pregnancy, I do have a quick question from you. It's funny that you mentioned that, because one of our callers wanted to know, women with diabetes, is it safe for them to get pregnant?
It is safe for them to get pregnant. It has to be monitored. And if you guys, anybody who's had a baby, know that there's a test called a glucose tolerance test where you drink this lovely drink. And the objective is to raise your sugar and see how quick it goes down. Now, there's a lot of gestational diabetes, which can cause several other problems at childbirth and for your child. And there's some recent stats that show that if you had gestational diabetes, you are more prone to get diabetes as a little bit later on in life, or even after you have your child. So the fact that the pancreas chooses not to do what he's supposed to do at that time is an indicator that we need to try to do something to strengthen him. Being proactive on taking care of that organ. So yes, you can have a child and have diabetes, but you need to monitor it. It needs to be monitored more than what you did before. So that's very, very important that you monitor it. And the younger the person, the more they have to take a little bit more control over that condition, especially when they become pregnant. They got to pay a lot more attention to their bodies. You guys have to understand, when you go to the doctor, we see you once every 3 months. You see yourself every day, I hope. Mm-hmm. So when there is a change. We're not ignoring changes. Last week, to know your numbers, we talked about we're going to make you doctors of your own temple, and that's going to require you to pay attention. So the answer is yes, they can. They just need to pay a lot more attention to the changes that happen in their bodies.
So the moral is, before you get pregnant, right, make sure you don't have test yourself before you get pregnant, right?
Not necessarily. You should test yourself anyway, but
when they
go to the doctor,
they do. They're going to get tested.
Which brings me to my next question: gestational diabetes. Women who develop gestational diabetes, are they likely to develop type 2 diabetes?
Yeah, that's what we were just talking about. Yep, exactly. Yeah, they're likely to get type 2 diabetes because remember, type 1 was not producing enough insulin, and they would have had that before. Or that would have been our juvenile diabetics.
Okay, I get what you're saying now.
So, yes, they would have. Now, can a person, and I think what your listener might be asking is maybe if a person has gestational diabetes, is there a chance that after they've had the baby that they no longer have diabetes? And that is absolutely possible. It's absolutely possible. But you also have to take more control at that time, because you already know that when your body has a problem, you have that organ that just starts saying, I quit.
So that's a good warning sign. Like
it's a good warning sign. Okay. Exactly. All right, Troy, I think it's your turn. You got any more myths over there?
Yeah, as a matter of fact, here is one that was brought up. Insulin is the last treatment for diabetes.
Okay, insulin is the last treatment. That is not necessarily true. I try my best to figure out what we can do before insulin, but it depends on the patient. And unfortunately, because a lot of people have not been respecting the condition, you have a lot of providers that want to put you on like Lantus at night. They want to put you on insulin because they know that it's going to get some control. But again, if you let the providers know, some cases you can actually help navigate your path so that insulin may not be in it. Maybe your doctor says you lose 15 pounds. We'll try you on this, lose 15 pounds. We'll try you on a tab and see what happens. And you have to be controlled of monitoring that.
So does taking insulin means I failed?
No. Okay. That's very good. Thank you. It does not mean that you failed. And one thing that's another, I'm doing soapboxes here. Another issue I have is sliding scales. Listeners, if you're on a sliding scale, it does not give you a get out of jail free pass. It doesn't mean that if you take your sugar and it's a certain amount, then you have to slide your scale of insulin. Now, that does not mean that you can eat what you want and slide your own scale. That can ultimately end you up in a stroke. So I want to be sure that you understand, too, that having insulin doesn't mean you failed, and it does not also mean that you are stuck on insulin forever. That's what our Healthapalooza, that's where our diabetic survival packet is about. It's just giving you the options to try to help take better control of your condition by using either a natural method or nutritional method.
Okay, just speaking of the Healthapalooza, or however you say it, what date and time was that again? Because I get confused.
It's the 20th, and it's all day, May 20th, and it's at our location. If anybody is in the Dallas Metroplex area, be sure to hit one of us up on our websites or call 214-455-8256 to register for the Healthapalooza. It's going to be amazing. We have several vendors, and we're going to be doing several testings and getting more control, answering some of your questions on a one-on-one basis. I love when people with certain issues come together because I learn, they learn, we learn, and that's how we're going to grow, and that's how we're going to beat a lot of these conditions.
I like that. I like that attitude.
Yes.
You stick in there, you might.
I might be somebody.
So I have a very good friend of mine. His name is Everett, right? So he has another question about, in particular his diabetes, is the fact that he wants to know is being out of control part of diabetes?
Being out of control of what?
Everything from your blood sugar to, like everything to how you feel, your mood, etc. All the conditions that come with it.
I think he means like how you were speaking on knowing your numbers.
Right.
I think he means like just not knowing and having that unawareness of out of control.
Being out of control of your diabetes numbers can cause a lot of things. Now, I want you to listen real closely, husbands and wives. If your sugar is not under control, there is a good chance that the spouse that has diabetes has a very short fuse. There's a chance that their moods can go from one extreme to another extreme. Now, I'm just using that as an example, or that group as an example, because as the caller suggested, can being out of control affect you in different ways? Yes, it can affect your mind. It can affect your heart. It can affect your sleep pattern. It can definitely affect your weight. So those of you guys who are trying to lose weight and seem to be doing everything under the sun and you don't seem to lose weight, maybe that's not the problem. Maybe let's go back to, as I told you before, I always ask somebody, if I can fix one thing, what will it be? Because the trickle effect is amazing. So if we focus on diabetes, you might lose weight as a side effect. You might have a better perspective as a side effect.
Yes.
You might have a healthier cholesterol number as a side effect. Okay. So that's why doing things, and those of you guys who are not close, you can get Healthapalooza by actually getting your diabetic survival pack and then your healthy me survival pack.
I like that. And I have one more myth, and I want to run it by you and Kiara. Okay, this one kind of ties into the initial question about sugar, etc. But it's for artificial sweeteners. Are artificial sweeteners better for you than just simply sugar?
I am not a fan of artificial sweeteners at all. Now, if you're going to sweeten something, I actually like organic honey.
Really?
It's like
Okay.
basic honey.
Yeah, honey's very important.
Now, it's not going to take you to that Texas Kool-Aid taste now without putting way
Sweet
too
tea.
much in it. But if you just need a simple sweetener, there's a couple of sweeteners out in the market, but I suggest that you actually shop around on your sweeteners. Now, you have several sweeteners that will have captions that might say things like causes cancer in laboratory rats. Well, if you want to use that sweetener, then and not saying that it's a bad one, but I personally
It is bad.
don't like several sweeteners.
It's scary when they had that on the back of the packet. That's
When they're
really-
forced to put that on the back of the package. But what's even more scarier is we continue to pack
use
it
it.
open
and
and
not we.
use it.
Yeah, some people do, but not we.
Yeah,
Right.
there you go. There you go.
So I personally use the blue agave syrup. I was
Awesome.
like,
Awesome.
is there any negative
Yeah,
feedbacks
awesome.
on that one? I was like, so far, I absolutely love it. I don't miss a beat with the sweetness. I can add it to anything, and it's amazing because I even cook with it as well.
Right.
So you know how sometimes you just need to add a little sugar to something. I just go ahead and add my little blue agave syrup, and we're good to go.
Yeah, it's becoming a lot more popular. So okay,
Right. Do we have to take a break?
Yeah,
You
we'll
know,
take a quick
we're on a
break.
roll.
Yeah, exactly. We're good. We're good.
All
Okay,
right.
Hey, guys, stay tuned. We'll be right back with Medical Message Moments. We'll see you guys in 2 shakes. All right. Welcome back to Medical Message Moments with Dr. Tracy Dorsey. All right. I'm a co-host, Troy, and we are joined today by our good friend, Kiara, and we are talking about the topic of diabetes. Kiara, you had some more information for us?
I do. I actually have one good childhood friend of mine who has had diabetes since high school.
Mm-hmm.
He wants to know, is it safe for him to get a tattoo?
Yes, he can get a tattoo. Diabetes is no longer considered the scarlet letter. It's very socially out there. And so it's a temporary thing where it's depositing glucose. Now, what you do with it is the problem. So he can get a tattoo. That's not a problem at all. But I'm happy that he's thinking about the fact that he has diabetes and thinking about his choices. Because, again, that's half of what we're talking about is our choices. So that's a good question. Thank him.
Okay, awesome. And one more question, which I am so happy about this one because this is actually from one of our younger viewers. They want to know, should you know if you have diabetes by your symptoms?
That is a great one.
Yes.
Now, yes, you can tell a lot about diabetes with your symptoms, but I will say this. Several symptoms mimic other things. So what's important about what he said is knowing that this is not your body's norm. So you can tell a lot about yourself by what is different. So that question is, yes, you'll be able to tell if you're a diabetic sometimes by your symptoms. Your symptoms are generally what make you go to the doctor in the first place. And that's also the bad part is that's the first thing that you start ignoring is your symptoms.
Yes.
Because we'll figure out a way to put a Band-Aid on anything. I have patients that have headaches every day. It's not natural for you to have a headache every day. So if that's the case, that's a Band-Aid is the Tylenol you may take. You know, in my case, the Band-Aid may be the peppermint oil that I inhale so I could get rid of the headache. So yes, those are all signs, and the body will tell you when it's craving and needing or missing something. So many people are missing minerals, and that's one reason why we started the show with the supplements. I am going to go back really quick, and I want to talk about some foods that have some of the supplements in it that we talked about earlier. So does either one of you all remember, listeners, you guys can't answer. I'm just trying to see if these guys are paying any attention to me. What was the number one supplement I want you guys to start if you are a diabetic, a pre-diabetic? I want you to call me, and we're going to start this immediately.
Coriander.
Chromium. But I'm happy you mentioned that because that's coming up next too. Good job, Troy. So chromium. Now, again, I want you to have 200 milligrams 3 times a day. If you are a diabetic and you can hear my voice, I need you to call me or go to the website or at least send me a message so I can send to you how to get a good supplement because this will help navigate your diabetes.
And just a side note, to get great supplements, right, you can go to www.preventedmedical.net. Oh, okay. All right. So we can go there
now,
also, right?
chromium is also very high in green vegetables. Broccoli is probably the highest. So if you want a power food, Broccoli is a great power food for a diabetic. Now, people often ask me, they want cures. I don't have a magic wand, but I do have a couple of magic beans. And that's what I'm giving you right now, the things that are going to help you by healing you. It's not going to happen overnight, but you also didn't get your conditions overnight. So we want to make sure that we are strengthening that pancreas. I don't like to use things like reverse diabetes. I see that a lot. Or cure diabetes. I see that a lot. I'm not saying that we're going to do those, but if the side effect is that occurs, wonderful. What I am telling you is that we can control, maintain, and stop the disease from accelerating. Now, again, as a side effect, you might have your numbers go down. As a side effect, they may take you off medication. As a side effect, you feel a whole lot better. As a side effect, you lose weight. All this can occur, but we want to stay focused on the prize, and that's protecting that organ.
That's a good way of looking at it.
Mm-hmm. The other one that we talked about earlier is magnesium. Now, magnesium is going to be in some of your grass-fed beef if you eat meat, a lot of your veggies, certain nuts and fruits will have magnesium in it. Magnesium is something that people haven't been paying attention to, but you also want to make sure you consult a provider to make sure you're taking the adequate amount and not overdoing magnesium. So we want to be sure on that. We want to watch potassium. You know, those of you guys who are having charley horses, circulation problems, maybe this is something that we need to evaluate. Okay?
Very good, very good. Okay, now, Kara, did you want to chime in, or you got another question for us?
No, I don't, actually. I just had, can you, I know that you're mentioning the foods right now, but is there anything else that you have for us? Is there any oils or what else can we do? Now,
everybody knows I am a huge fan of oil therapy. Yes. A huge fan. Now, Kiera is my herb or oil therapy specialist. Troy is my herb specialist. So I'm surrounded by just wonderful knowledge right here. And each week we want to give you some. Next week you got a big surprise. You got these two who are going to give you a ton of knowledge. Now, oils are my passion. I think there's two that we really want to concentrate on if we are going to try to take control of this diabetes thing. Now, I'm going to give you these two oils, and I want you to understand there's several ways you can get that oil to your body. Okay? The first one is going to be, again, my cinnamon. I can't say it enough, but cinnamon comes in an essential oil as well. The other one is coriander. It comes in an essential oil. Now, the beauty of coriander is it actually helps the liver with the production and how it processes glucose. Now, what you can do with these oils is several things. We can add a carrier like almond oil. We can mix those oils together. You can put it at the bottom of your foot so that it can actually hit your system very quickly. If diabetics often have scaly skin, dry skin, they have wounds that don't heal. Well, you could add this and make your own butter. Now, more importantly, if you really want to stay ahead, you can get Kara over here to do your mix for you, so you don't have to worry about that. So we can mix you a border, and we can mix your oils, and we can mix you over the cream, so that you can use this for your feet that are very dry.
Very good, very good. And Kara, so if they want to get that done, how would they get in contact with you?
Sure, you can check out the website. It's kabaremedies.com. That's KABAREMEDIES.com. kabaremedies.com. And like Dr. Tracy said, Dr. Dorsey said, I'm sorry, she has she's right there on it. Lots of the oils, they just do so much for the skin. Another oil that I wanted to chime in on, as far as like having or healing those achy or scaly skins, is grapeseed oil.
Right.
Oh. You can also cook with grapeseed oil too, and it's another one that's really awesome for diabetics.
Excellent. Okay, guys, we'll be right back here. We're going to come back from break here, and we're going to wrap the show up. Okay, this is Medical Message Moments.